Now in this segment, we're going to be covering infant to rescuer healthcare provider CPR. And I should talk about some of the different nuances when you add a second trained rescuer to infant CPR. Number one, you have somebody else equally trained that can share the responsibilities. That's true. But the difference between an adult versus an infant is that we're going to change the technique we use to do the compressions if we can. Now, though we are going to be doing circumferential compressions with our thumbs, that does not mean that if you have thumb problems, arthritis, or loss of thumb, that you can't revert back to using the fingers. That's allowable as well. But the difference here is that you have somebody who's going to be able to do the rescue breaths while you concentrate on the compressions. Now, another difference is that we go from 2 breaths and 30 compressions down to 2 breaths and 15 compressions when we have a second rescuer helping us. The rest of the scenario works pretty much the same. If we begin to fatigue and we're unable to continue the compressions, we can call out a switch, change positions, and switch roles as rescuers. But everything else kind of remains the same. So here we go. Our scene is safe, our gloves are on, we have a bag valve mask to do respirations. We're going to call out to the baby. Hey baby, are you okay? Stimulate with tapping of the feet or rubbing the chest. Are you all right? There's no response. You in the plaid shirt, go call 911 and come back. And when you come back, bring an AED if you can find one. Or call a code. Now that that's done, we're going to assess for normal breathing and we're going to check for a brachial pulse. We check the brachial pulse for no more than 10 seconds. If the pulse rate is below 60 beats per minute, I'm going to begin CPR. If the pulse rate is above 60, we're going to do rescue breathing. But in this case, there's no pulse, no regular breathing. So here we go. We're going right into chest compressions, finding the nipple line and dropping my 2 fingers down if I can't use my thumbs, or I'm going to come around and actually use my thumbs and wrap my fingers around the chest of the baby. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11, 12, 13, 14, 15.
Breath. Breath.
Both breaths went in, so I continue my compressions. 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13 and 14 and 15.
Breath. Breath.
Continue with this cycle. If I start to fatigue, and I will fatigue, I'm going to say, Jody, we've got to change after this set. Change 2 and 3 and 4 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15.
Breath.
He delivers 2 more rescue breaths, and then we switch.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15.
Baby breath, and another baby breath.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8.
So we're going to continue this compression to rescue breath sequence with changes ever so often as we fatigue, probably every 2 minutes max, so that we're able to stay as strong as we can to do consistent compressions. And we're going to do this until EMS or help arrives, an AED arrives, or the baby revives.